Hello, my beautiful people. Welcome to this video where we are going to talk about something soft, light, chill. Deadly diseases. Yes, I know. Just hearing the word deadly already gives you a mini heart attack. But calm down, nobody's dying here. We're going to understand them, laugh a little, learn a lot, and leave this video smarter than when we came in. Because here's the truth. Life is a party. But the human body is sometimes a dramatic guest, and today we're going to find out why. Ebola. Ebola is not just a disease, it's a movie villain. If there were a cinematic virus universe, Ebola would be Thanos. What it is? A virus that causes hemorrhagic fever, meaning damage to blood vessels, internal and external bleeding, and extreme inflammation. Why it's so deadly? It attacks fast, destabilizes the body, and can kill in days if untreated. How it spreads? Contact with bodily fluids of infected people or animals, especially bats and primates. Ebola is basically the virus your body looks at and says, "Bro, what did you ever do to me?" Rabies. Rabies is one of the most unforgiving viruses on the planet if not treated immediately. How it spreads? Through bites from infected animals, dogs, cats, bats. Why it's deadly? Once the virus reaches the central nervous system, that's it. Rabies, once symptoms appear, has a fatality rate of nearly 100%. Symptoms progress fast: confusion, hydrophobia, seizures, paralysis. So if a suspicious animal bites you, get vaccinated immediately and you're good. AIDS/HIV. All right, let's talk clearly without fear and without unnecessary drama. HIV doesn't kill directly. What can kill is the damage it causes when untreated. What it is? HIV is a virus that attacks the immune system, specifically CD4 cells, basically the soldiers that defend your body. It's a silent thief. It sneaks in, settles down, and slowly disarms your defenses. How it spreads? Unprotected sex, contact with contaminated blood, sharing needles or syringes from mother to child during pregnancy, birth, or breastfeeding if not treated. It does not spread through hugs, kisses, saliva, sweat, sharing cups, or simply existing near someone. Why it can be deadly? Without treatment, the immune system becomes so weak that simple infections become extremely dangerous. That advanced stage is known as AIDS. Treatment and prevention? Today, with antiretroviral treatment, people live normal lives. The virus becomes undetectable. Undetectable means untransmittable. Prevention? Condoms, PrEP, regular testing. Information literally saves lives. Crimean Congo hemorrhagic fever. This disease comes with a long name and intense attitude. How it spreads? Bites from infected ticks or contact with blood or tissues of infected animals. What it causes? Severe hemorrhagic fever with bleeding, high fever, and organ failure. Why it's deadly? It can cause shock, internal bleeding, and multiple organ failure. Treatment and prevention? There's no specific vaccine. Prevention includes tick control, protection when handling animals, and early medical care. It's not common, but when it shows up, it doesn't knock first. Pneumonic plague. Yes, the plague, the same one that terrified humanity, but in lung version. What it is? An infection caused by the bacterium Yersinia pestis that targets the lungs directly. How it spreads? Through the air, respiratory droplets. Why it's deadly? It progresses very fast. Without immediate antibiotics, it can be fatal within days. Good news? Today we have effective antibiotics. History plus science equals survival. Lassa fever. A disease that proves mice are not always cute. How it spreads? Food contaminated by rodent urine or feces, contact with infected people. What it causes? Severe hemorrhagic fever, liver damage, and respiratory complications. Treatment and prevention? No vaccine. Prevention includes hygiene, rodent control, and early medical care. Yellow fever. Here comes the mosquito with a PhD in causing chaos, Aedes aegypti. How it spreads? Bites from infected mosquitoes. Why yellow? It can cause jaundice, yellowing of the skin and eyes. Why it's deadly? It can lead to liver failure, bleeding, and shock. Prevention? There is a highly effective vaccine. One dose can protect you for life. Pneumococcal pneumonia. One of the most dangerous pneumonias. What it causes? Severe lung inflammation, high fever, chest pain, and difficulty breathing. Why it's deadly? In children, the elderly, and immunocompromised people, it can progress to sepsis, respiratory failure, meningitis, and shock. Prevention? Yes, there's a vaccine, and it works very well. Tuberculosis. The famous TB. How it spreads? On the air when coughing, talking, or sneezing. What it causes? A chronic lung infection that slowly destroys tissue. Symptoms: persistent cough, coughing blood, fever, night sweats, weight loss. Treatment: it is curable but requires long and disciplined treatment. Without treatment, it can be deadly. Meningitis. A disease that doesn't warn you, it just runs. What it attacks? The membranes protecting the brain and spinal cord. Why is it dangerous? It can progress in hours. Symptoms: severe headache, stiff neck, fever, confusion. Prevention: there are vaccines for the most dangerous types, and they save lives. After seeing all these diseases, it's clear that life is fragile but also powerful, because knowledge protects, prevention saves, information transforms. The purpose of this video is not to scare you, but to wake you up. Your health is your wealth. Taking care of it is honoring your life.